You're listening to PetLifeRadio.com.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
Hello, I'm Dr. Bernadine Cruz, and you're listening to The Pet Doctor on PetLifeRadio.com. You're likely listening to this podcast because you have one or two that sleeps in your bed, eats at your table. You sometimes dress them up and spoil them as if they were your children. Dogs, they become part of our families, and we want the best for them. But how do you know if they're receiving the best care possible, and what is best for one pet? Is that the best for yours? My guest today is Dr. Nancy Kay. She's a board-certified specialist in the American College of Veterinary Internal Medicine. Her passion is communications between veterinarians and their clients. Her new book is Speaking for Spot. Be the advocate your dog needs to live a happy, healthy, longer life. We'll be right back after the short break and find out why you need to be your dog's advocate. We'll be right back.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Pawfume Dog Grooming and Finishing Spray is proud to be a new sponsor of Pet Life Radio. Pawfume's super long-lasting sprays are available in 4 unique fragrances. Each Pawfume spray is fortified with the finest conditioners and detanglers to make combing out your dog more fun. Pawfume retails for only $2 per 6-ounce bottle. Pawfume is available nationwide at all Dollar General and Family Dollar stores. Why pay more to have your dog smell great? Pawfume, Pawfume.
It's time for school for you and your friends, your furry best friends. Train your dog the fun and easy way with Teacher's Pet Sessions. Teacher's Pet host Pia Silvani teaches you step-by-step how to train your dog the fun and easy way. You get 8 30-minute live audio training sessions, complete transcripts of each session, plus a basic training manual to get you and your dog off to a great start. Training begins the moment you bring your dog home. Teacher's Pet Sessions offers positive reinforcement training to shape your dog's behavior and encourages upbeat, enthusiastic responses to ensure that your dog will enjoy learning. Teacher's Pet Sessions dog training is fun at both ends of the leash. So listen, learn, and laugh with your dog with Teacher's Pet Sessions. Get your copy of Teacher's Pet Sessions Volume 1 today. To order, go to teacherspetsessions.com.
Hi, this is Pia Silvani, your host. Bring your dog, tug toy, and treats, and get ready to have some fun.
teacherspetsessions.com.
Coast to coast and around the world, it's Oh Behave with Arden Moore. Find out why cats and dogs do the things they do, and get the latest buzz from wagging tongues and tails in Rin Tin Tinseltown. From famous pet experts and best-selling authors to television and movie stars, you'll get great tail-wagging pet tips and have a fur-flying fun time. Oh Behave with America's pet edutainer, Arden Moore. Every week on demand. This is the place for a special paparazzi treat. Only on PetLifeRadio.com. Let's talk pets on PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
Dr. Kay, thank you so much for being with us today. This is such an important subject because we're the voice for our animals. Why did you write this book to begin with?
Well, the main reason that I wrote this book is I had a medical scare of my own approximately 3 years ago. A few months of my life were blown off course by a significant medical scare. There were a number of conflicting opinions. No one was quite sure whether or not what I had was serious. And although I felt a good deal of anxiety throughout the entire ordeal, I also felt incredibly fortunate because I knew how to be my own best medical advocate. I knew how to ask all the right questions. I knew how to find the right doctors. It turns out I avoided a needless surgery because I didn't listen to the opinion of just one doctor. I sought out several different opinions. It turns out everything turned out fine. My health is great. But I came out of the experience thinking, wow, this was such an incredible asset to me to be able to advocate for my own health. How can I possibly give this gift to other people, especially people without medical training, the medical training that you and I have? And I thought it might be a little presumptuous of me to write a book for people in their own health, so I thought I would begin in my own backyard and started with dogs. And that's basically the seed from which germinated Speaking for Spot.
It is such a necessary thing, as you're saying. I was glad to hear that your medical issues turned out okay. But right now, my mom is very mature, and going with her to her doctors, I feel like sometimes my clients must feel when they're coming to me and bringing their pets because my mom doesn't know what questions to ask. They tell her something, and some of it goes in one ear out the other, and she's just lost. And oftentimes they look at me, well, you're just a veterinarian. It's like, no, I think I know still some of the things that are going on. How can someone be the advocate? Oh, well, maybe I should back up a bit. You take care of dogs and cats, and this is Speaking for Spot, a dog. Why did you write it for a dog and not dogs and cats?
Well, that's a great question. My intent was to write it for both dogs and cats, but it would have ended up being a ginormous book that no publisher would have taken on. And so I had to pick one or the other, and it was almost like the flip of a coin, and I chose to write about dogs first, and now the publisher is talking to me about writing Talking for Tabby, which will be a sequel to Speaking for Spot. You know, what you mentioned about your own mom, one of the things I do recommend in the book is to always bring along a hired gun, which means basically a second set of eyes and ears. That can, ideally someone even with some medical training who can filter through what all is being said and then debrief with the patient or debrief with the client afterwards.
I totally agree with you because so many times when clients are coming in and their pet is ill, they're scared. They have no idea what's going on. Is this just, a little bit of a limp because it was playing Weekend Warrior, or is it bone cancer? Too many people, and I have a headache. Whenever I have a headache, it's never a headache. It has to be a brain tumor.
I know.
So,
the disadvantage of knowing too much, right?
Definitely. I love it when clients bring in a friend and you say, okay, do you understand? And they're shaking their head, and oftentimes you see this glazed look that, okay, let's write things down so you can remember. And oftentimes my eldest sister and I will go with my mom, and here's two set of ears with my mom's ears listening, and each one of us seems to hear something a little bit different sometimes.
Yes, exactly right. The other thing, too, Bernadine, that you and I both recognize is that the grief process often begins well before death has occurred. The minute someone knows that their pet, their dog, has a serious disease, they may be in the midst of anger, they may be in the midst of denial, and they may tune out a good 50% of what it is that we're explaining to them.
If a person seems to have had a pet with a similar incident or a similar set of signs in the past, they'll oftentimes jump to the end and not realize that each case is a little bit different. Just because, you had a 20-year-old kitty that had kidney failure, and I now tell you that this one has some weakening kidneys, it doesn't mean that the progression is going to be the same.
That's exactly right.
So how can somebody be the best medical advocate?
I think that being the best medical advocate involves the following. First, it's getting an explanation from your veterinarian about all that your veterinarian understands to be true about your dog or your cat, and then gathering as much information about all the different options for either diagnosing what your pet has or treating your pet, finding out all the pros and cons, all the risks and benefits of every single option, so that you're really on a fact-finding mission. And then it's a matter of combining that factual information what your veterinarian has told you, perhaps what you've read online or read in various books, and then combining that with what you know to be true about your dog or cat, about your dog or cat's intrinsic personality, and how they might deal with the various different options, what might really be best for them, what would best suit their personality. And then on top of that, you need to combine that with your value system. How do you feel about aggressive veterinary medicine versus a more empirical therapy approach, meaning just treating the symptoms rather than finding out what's actually wrong? How do you feel about treating cancer in dogs and cats? Certainly combining that with one's financial means. And then using all of that to try to come up with the best decision possible for your dog or cat, number one. And number two, the best decision possible for your own peace of mind. So being an effective medical advocate means being extremely informed about all of the various options, and that responsibility falls on your shoulders as well as the shoulders of your veterinarian, and then combining it with the more subjective information that you have access to, meaning what you know about your pet and what you know about your own value system.
Two things that just really strike home with me. Number one, you're saying that you know your pet basically better than anyone else. You know its own little idiosyncrasies. And there have been so many times a client will have brought in a pet and they tell me it looks ill. You know, it's doing something different.
Yeah.
It ain't right, doctor. And I look at it, you look at it and go, you know, it really looks pretty decent to me. Maybe it's a little bit of an older pet, but on physical examination, everything looks fine. I learned a long time ago that don't doubt the owner. They know this pet so well. And I'll pursue things, and many times like, oh, look, we do have this underlying problem that I didn't see otherwise. So whenever possible, I'll tell clients, and right now, money being tight with the economy as it is, bring your pet in at least once a year. Twice a year is so much better. So your veterinarian gets to build this team with you being the eyes and the ears and the fingers at home to record what's going on. And when you come in to see your veterinarian, bring a little health diary with you, because you may be seeing, oh, it seems to be drinking a little bit more water, but it's been warm outside. That's why, yeah. Mm-hmm. But you mention that to your veterinarian, they go, let's look into this further. The other thing that you mentioned, Nancy, that I think is critical for people to understand is where they get their information. You mentioned going online, and I find great things online, but I also find disasters. Could you address a little bit about, just because you see it online doesn't mean that it's factual, that it's credible?
Exactly. What I encourage people to do is to take the symptom that they're investigating or take the disease diagnosis that they're investigating, plug that into Google, and then the very next word should be veterinary school or veterinary college. And so that will pretty well, you can be assured it'll take you to a website that has reliable information because it's put out by a veterinary college. Also, if you happen to have a purebred dog, let's say that you have a Bernese mountain dog. I don't know if your listeners know what type of dog that is. It kind of looks like a St. Bernard, but brown and black and just big and beautiful dog. And let's say that your Bernese mountain dog is diagnosed with malignant histiocytosis, a type of cancer they commonly get. Go to the Bernese mountain dog website, and you'll find some very reliable information there as well. What you don't want to rely on is one person's impression of what happened to their dog and why. And also, if the website would benefit, if the people who have posted the website would benefit by you reading their information and then purchasing something from them, that's also a website that you really want to take with a grain of salt. I'm not telling people not to read the National Enquirer. I'm just saying to read it purely for entertainment purposes, but don't bring that information into the veterinary office visit with you.
There is a lot of wrong information out there. You're exactly right. And breeders, yes, breeders can have some interesting ideas. I love your idea, however, of if it's a purebred, go to one of the sites, because so many of these breed organizations are funding some fantastic research. Dobermans, looking in von Willebrand's, a bleeding disorder, gastric torsion. They're funding because they know their animals are so affected, and if they find something that helps theirs, and oh, by the way, it helps your dog that's a mix, all the better for you. Lucky you.
Absolutely.
With all of these treatments that are now available, you're talking about chemotherapy, and people get really scared off when they hear that word chemotherapy because they had their Aunt Nell undergo chemotherapy for some type of a cancer, and she felt horrible, and her hair fell out, and she was vomiting all the time. I know that you are a board-certified internist. What is your feeling? How do you typically counsel your clients when they say, the dog has cancer, I just don't want chemotherapy because I've seen what it does to people?
Sure. When I counsel people on chemotherapy, as soon as I introduce the concept of chemotherapy, the next sentence out of my mouth is, thank goodness dogs and cats don't tend to experience the side effects from chemotherapy that we humans do. And in fact, if dogs and cats got as sick from chemotherapy as we do, you'd probably be hard-pressed to find many veterinarians who would be willing to administer it. Even though we're using the same drugs, hair loss is exceedingly uncommon, as you know, and occasionally we have dogs that have some vomiting or loss of appetite, but that's the exception rather than the rule. So I encourage people to be a little bit open-minded that different species behave differently with these drugs. But the truth be told, Bernadine, if someone really has just gone through a horrific experience with a friend or relative who has been ravaged by the effects of chemotherapy, they may not be able to handle the notion of chemotherapy for their pet no matter how much they understand the reality of it for dogs and cats, and that's okay. Again, it's all about bringing their value system to the table in terms of making a decision.
And I think it's great, even if they don't want to progress and they think, I don't know, I'm not really sure about this chemotherapy. I'll always tell them, because I'm very fortunate in Southern California to have several board-certified veterinary oncologists around my practice. Okay, just go and chat with a specialist. They know what the chances are that we're going to have a good outcome. They can tell you what the side effects can be. They can tell you what the cost is going to be because they do this every day versus getting it third-hand information from me. And even if you say, no, I'm not going to do it, you've gone up the learning curve. You know what you are saying no to.
Right,
so,
you're making an informed decision.
Exactly. And then maybe 6 months down the line, whatever it is, when now this pet is having to be put to sleep because the cancer has progressed, they can't look back and oh, gee, I wish I had done this.
Exactly.
They had that informed decision.
That's the second part of being a good medical advocate. You want what's best for your dog or cat, but you also want what's really best for your long-term peace of mind. When it comes to the chemotherapy issue, the one other misconception that people commonly have is that they have to sign up for 6 months of chemotherapy or 6 weeks of chemotherapy. So if they go for chemotherapy, they're going to have to stick with it. And nothing could be further from the truth. In fact, one of the things that I really spend a lot of time talking about when trying to make a decision about how to proceed with your dog or your cat, it's important to think about, can we stop if we don't like what we see? And so what I always encourage people to do, you and I both see a lot of lymphoma in dogs and cats that's treated very successfully with chemotherapy. I say don't make a decision now about if we're going to go for 6 months of chemotherapy. Right now, let's make a decision about whether we're going to do the first chemotherapy and see how your dog or cat responds and see if there are any side effects. And then in a week, we'll reevaluate and see if you want to go further. So people can understand they're really signing on for the first chemotherapy, not 6 months of chemotherapy when they say yes.
And one reason I am so glad that I am a veterinarian versus being an MD, if it gets to the point where that quality of life is no longer what the owner wants for that pet, and everyone has that different definition of what equals a good quality of life, undergoing chemotherapy or whatever the situation is, veterinarians have the privilege of allowing a pet to pass on quickly, painlessly, and with dignity. And they don't have to keep getting that chemotherapy, which is making them feel lousy. Right. They can just say, no, it's time to let them go.
Sure. I think it's one of the most respectful, loving decisions a person can make for their pet.
One of the things talking about going to get that opinion for the oncologist, why are so many people so hesitant to get that second opinion on a health matter for their pets or sometimes even for themselves?
Well, it's funny about that, Bernadine, because it's a real emotional response. People are worried about hurting their veterinarian's feelings. And I see it in the human field, too. When someone says, I don't want to get a second opinion, I might hurt my doctor's feelings. And what I always think in my own mind, and I'll sometimes say, is what's more important, the feelings of your veterinarian's feelings, or your dog's health? And then they too will chuckle and say, well, of course it's my dog's health. So what's important to counsel people about is veterinarians, we all expect that our clients will want second opinions. And there's times I encourage a second opinion so that someone will have more confidence about the way in which they're proceeding. So it's just an ingrained sense of, I don't want to hurt my veterinarian's feelings. And when you think about that logically, from a place of logic rather than from a place of emotion, that doesn't make much sense. I think the other reason that people feel a little strange about getting a second opinion is that they feel that they can't then come back to their primary veterinarian. And again, nothing could be further from the truth. All you're doing is going and getting a second opinion. And in fact, if the second opinion concurs with the first, you'll probably come right back to your primary veterinarian. In the human field, second opinions result in a different diagnosis approximately 30% of the time. And we don't have any such data in the veterinary field, but as someone who part of every week I'm giving second opinions, those are a good part of my office visits, I would venture to guess that same statistic would hold true.
And being one of the veterinarians that refers to internists and to everyone else, it never hurts my feeling if somebody wants to get a second opinion. Oftentimes people are coming to me just because they've heard from their friends, I like Dr. Bernadine, go see her.
Yeah.
But I know in my heart, I don't know it all. I can't expect to know it all. There's so many advances going on in veterinary medicine that when I finished veterinary school, they said in 10 years, 50% of what you've learned is going to be outdated. It's up to you to know which 50% that is.
And so what some clients do, let's say a client of yours wants a second opinion but is worried about hurting your feelings, then they might, what I call, sneak out for a second opinion. So they arrive at the office of the internist who says, well, what were the results of the x-rays? Can I see the x-rays? And, well, what did the laboratory data show? But because your client has snuck out for a second opinion, they don't have in hand copies of the laboratory data. They don't have the x-rays to show the internist, which means all those tests need to be repeated, or the person giving the second opinion needs to convince the client that you need to be involved in the loop. So it's far better to just say, hey, I want to get a second opinion. And if your veterinarian's ego is dented by that, then that's really their problem, not your problem.
I totally agree. Great information. And you were talking about a lot of that second opinion having to repeat tests because you kind of snuck out. You didn't want to hurt someone's feelings. I'd like to talk about finance right after this short break. So right now you're listening to Dr. Nancy Cave, How to Be Your Dog's Health Advocate. We'll be right back after this short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Give your dog some thought with Dog Thoughts. It's the iPhone application that everyone's talking about.
Hey, what do you think of this? A man in Davis, California says he's invented an application for the iPhone that claims it can read your dog's mind. Huh? No, it's true. Now, I read about it on my cat's Twitter page. That's why
Jay Leno talked about it, CBS reported on it, and now you can see what all the buzz is about. Created just for dog lovers, Dog Thoughts makes taking photos of your furry best friend more fun. Shake your dog and read his mind. On your iPhone, of course. Take a pic of your pup, shake your phone, and watch as his thoughts appear on the screen. Does he have a bone to pick with you, or is he having a tail-wagging day? Get your Dog Thoughts iPhone app today. Just 99 cents. Go to PetLifeRadioPromotions.com. That's PetLifeRadioPromotions.com.
Greetings, human. What planet Welcome to Pet Planet. Here's a copy of Pet Planet magazine, Florida's most informative and fun pet resource magazine. It features heartwarming stories and informative articles from local and national pet experts.
Excellent.
Pet Planet magazine offers Operation Planet Rescue, helping rescued pets find new homes. And it's available at 500 locations in South and Central Florida and 24/7 on the internet at petplanetmagazine.com. If you're out and about with your pet, you may be featured in Paparazzi, candid pictures of you and your pet. For up-to-date pet-friendly events, activities, and pet-related services and products, Pet Planet magazine is your final destination.
I shall take this magazine home with me.
Back to your home planet?
No, to my condo in Boca.
Pet Planet magazine. Check them out at www.petplanetmagazine.com or 352-394-8578. It's out of this world.
From Paris, New York, and around the globe, get ready for the hip, the trendy, the uber cool where pets rule. If you've got a passion for pet fashion and a flair for animal wear, this is the ultimate place to take a peek at what's chic in the world of designer pet fashion and cool new pet products. The Pet Set, every week on demand, only on PetLifeRadio.com.
Let's Talk Pets on PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
Dr. Nancy, veterinary medicine, I love being a veterinarian because of all the things that are available to us to help these pets. But they come with a price tag, and especially right now with this downturn in the economy, some of my best clients are coming to me saying, I just can't afford this. What's your recommendation to your clients or people that you talk to about affording the miracles in veterinary medicine?
Sure. Well, what I encourage is exactly what you described your clients do, which is to really lay their financial cards on the table when talking with their veterinarian. And I sense, Bernadine, that you're extremely approachable, but many people feel kind of squeamish about talking with their finances with their veterinarian. Talking about fleas is one thing. Talking about your bank account is a whole nother ballgame. And sometimes people feel that they're going to be judged negatively by the staff. They're worried that they may be thinking that this client's more concerned about money than the health of their animal. Well, I think everyone's in the same boat today. Everybody's being affected by this economy. So I'm certain that most people who work in veterinary hospitals would understand when you say, I really need to hear about all the options because I can't necessarily afford the option that we all think might be best. The second thing that I encourage is to look into the possibility of health insurance for your pets, especially if you are the type of person who would normally want to do everything possible to diagnose and treat your animal's diseases. Pet insurance, I've definitely priced it out. It costs in the neighborhood of $300 to $400 per pet per year. And when you figure out what kinds of problems could arise, for example, let's say you have a dachshund. Dachshunds are very prone to slip discs in their backs. If surgery is required, an MRI scan is required, that may be $6,000 to $7,000 from start to finish. And that's a situation where that health insurance policy would really pay. So I am encouraging more and more for people to look into the notion of health insurance because some of the things that we're recommending are pretty high-ticket items these days.
You go online and you put in pet insurance, and you get quite a few different hits of various types that are out there, some that are for a particular group of veterinary hospitals, some from the AKC, they have their own. How do you counsel your clients as to finding that policy that's going to be best for them?
You know, I actually walked through this process so that I could better write about it in my book. And honestly, the best thing that I can do, the best I can recommend is, if at all possible, take a peek at Speaking for Spot. There's a whole list of questions that I think are important to ask. Not find the answers online, but actually call the insurance provider and talk with a couple of human beings in their office and get the answers to these really important questions about pre-existing conditions, caps on problems. For example, here in California, many of our doggy patients, they get foxtails up in their noses not just once a year. They may do it 2 or 3 times a year. is there a cap on how many times that problem will be covered in the course of a year or in the course of the dog's lifetime? So it's a matter of, based on your animal and you know what kind of trouble your animal is prone to getting into, then discussing that, asking the right questions of the insurance provider. How long does it take to get reimbursements? If you want to contest a claim, what's that process like? So it's a lengthy list of questions, but I think it's worthwhile going through in order to find an insurance provider that's going to be right for you and your pets.
More and more people are getting pet insurance. I love it when I say, okay, I need to do such and such diagnostic test and take some x-rays and do an ultrasound. They go for it. I have pet insurance. Like, yes, that is so wonderful. And people say, well, why should I get it? So, well, if you're the type of person living here in Southern California or California in general that has earthquake insurance, probably a pretty good idea for you. You like to have that little cushion that's mind. Exactly. Kind of getting back to the subject of money. And I know in your book, Speaking for Spot, that you have a whole chapter on vaccines. Yeah. Why?
Well, as you and I know, that the nature of vaccinations has really changed over the past decade. When I graduated from veterinary school in 1982, we vaccinated every dog we could get our hands on for the 5 different things we vaccinated against, and we vaccinated them once a year, no questions asked. Well, now there's 13 different vaccinations available for dogs. And what we've learned is that the basic vaccinations that most every dog gets, what we call the core vaccinations, distemper and parvovirus, those that we used to think would last only a year, last now, we know, a minimum of 3 years once you're beyond the puppy shots. And so the recommendation for these core vaccines to be given annually has been changed. The American Animal Hospital Association gathered a task force together, and they looked into basic vaccine recommendations and guidelines. These aren't rules that veterinarians have to follow, but they're guidelines. And now the guidelines say that really for these core vaccinations that all dogs should receive, they really only need to get them every 3 years. In fact, in some dogs, we know that protection from these vaccines lasts for the entire duration of their lives. And there's blood tests that can be done to determine, once 3 years has lapsed, whether or not there's still protective levels of what we call antibodies in the bloodstream. So there's some dogs, once they get beyond their puppy vaccines, that might never need another vaccination. Why are we so up in arms about over-vaccinating dogs? Well, we've come to learn that for the most part, dogs do great with vaccines and cats do fine with vaccinations, but there is a small incidence of adverse reactions to vaccinations. And sometimes that adverse reaction can lead to a life-ending consequence. So whenever we think about a vaccine, it's not something that we do just willy-nilly, so to speak. Now we consider it to be a medical procedure. And as with any other medical procedure, we want to weigh all the risks and all the benefits. And if there's no benefit to be gained, but there is a little bit of risk, then we wouldn't want to give that vaccination.
Some great advice, and I know that more veterinarians are now vaccinating according to lifestyle and risk analysis. So if you have the dog that goes hiking and biking and goes traveling all over, it's going to need a different set of vaccines than the one that's just the indoor pup who goes to the backyard to poop and back in the house again.
That's right. In other words, the client needs to participate in the vaccination discussion. I have so many people who, when they get those vaccine reminder cards, and they're very intelligent people, but they quit thinking when they get the vaccine reminder card. They just go in with their dog and say, go ahead and give all these vaccinations without really having discussion about, does my dog need this vaccination? I tell the story in Speaking for Spot of a little dog named Missy who died of complications from a Lyme disease vaccination. Well, Lyme disease is spread by ticks, and this was a pristine little white fluffy Bichon Frise whose feet never hit the sidewalk, would never have had exposure to ticks. And had that conversation taken place, Missy would not have received the Lyme vaccine that ultimately ended her life.
As you said, it is so important for the pet owner to be part of the decision-making process for what procedures are going to be done to your pet. Is the risk worth the benefits to it? I think so many clients have gotten into the habit, especially those that maybe are the baby boomers and have had pets for years. They know they need to go in every year to get their vaccines, and that's why they're there. But I think many veterinarians are now viewing this yes, we send out the vaccine reminders, and that's more of a tickler to come on in, but the vaccines are taking really kind of a back seat to the real reason why we want you to come in at least once a year. Twice a year is even better. I had an incident yesterday. A kitty came in who was having some blood in the urine, an older Siamese. Taking a look at this cat, and this poor sweetheart was definitely a senior citizen kitty. Yes, it had blood in the urine. And oh, by the way, it had teeth that the only thing that was keeping the teeth in the head was the severe dental disease. It had a heart murmur. It had a tumor on the skin. It had some of these other things. And this was a brand new client. So I'm saying, hi, when was the last time your pet was taken to a veterinarian? Must have been about 10 years or so ago because it's healthy. It has no problems. And here's a sad situation where a lot of the complications that we were running into trying to address all these factors maybe could have been avoided if they were coming in on a yearly basis, if nothing else for their vaccines, but more importantly, for that wellness exam.
Right. And I agree with you wholeheartedly. I think sometimes veterinarians want to hang on to the notion of annual vaccination so that they have the assurance of getting that animal onto their exam table for a thorough physical once a year. So I'm not in general practice, but what I would want to do, I think if I was in general practice, is rather than sending out vaccination reminder postcard, would be to send out a postcard that says it's time for your annual physical examination, your dog's annual physical.
And people typically don't go in unless they're feeling ill. So if we can change the mindset for people, go in for your own well baby checkup.
There you go.
I go in to see my, OBGYN, and it's my well baby checkup. I call and go, I need a well baby checkup. And they go, what? So, I need a wellness exam. Oh, okay, fine. Come on in.
Right. The bottom line is if we discover a tumor when it's 1 inch in diameter, we have a far better chance of curing that disease than if it's a tumor that's 4 inches in diameter. If we discover a heart murmur in its earliest stages and find out what it's about and begin treatment, we might be able to avoid an episode of heart failure. So the earlier we detect things, the better for the patient, no question.
And it definitely usually costs less to treat and usually has a better outcome too. So
exactly.
It's a win-win.
We give heartworm preventive because we don't want our dogs to get heartworm disease. Turns out giving heartworm preventive is probably significantly less expensive than treating fulminant heartworm disease.
Definitely. In your book, you have a fascinating topic, the 10 Commandments of Veterinary Office Visits. Tell us, what are those 10 commandments?
Those commandments consist of things that clients can do to create a better result in terms of an examination for their pet, as well as a better experience for the veterinary staff and themselves. For example, a very basic one is, thou shalt let the staff know if your dog is aggressive. You and I have probably both been burned by, we're pretty good when we walk in a room. We can size a dog up pretty quickly. But every once in a while, a dog takes us by surprise and bites without a growl or without a glare. And I remember one situation where my hand was bitten, I was bleeding, and shocked because I hadn't read this dog to be a biter at all. And then when I came back in the room after cleaning up my wounds, the client said, oh, yeah, he did that with the last veterinarian that we saw.
Thanks. Appreciate telling me.
So that's a real basic commandment. The first commandment, which actually people have written it to me and told me they've enjoyed the most, is thou shalt push thy veterinarian off her pedestal. And what I mean by that is it's referred to often as the white coat intimidation factor, is you really want to be capable of honest, open communication, a good exchange with your veterinarian. And if you've put a veterinarian up on a pedestal, it's very difficult to have an open dialogue with her. I think that most pedestals are figments of the client's imagination. I don't think most veterinarians put themselves on pedestals. So take your veterinarian off her pedestal. And if you feel like you can't do that with a particular veterinarian, then you might want to move on to someone that you feel like you can have a more equal communication with, rather than feeling like someone's talking down to you or that you're talking up to them.
I think that's great. There are times I'm trying to relay a certain medical condition, explain what's going on, and seeing that kind of glazed look, the same look I have when I take my car into the mechanic, going, sure, whatever. And I love it when a client says, excuse me, could you rephrase that? I don't understand. And that never bothers me because it's my fault that I'm not reading them and I haven't made myself clear. So
and one of the commandments is thou shalt always pause for confusion. Because, yes, we do lapse into medical speak because we're so used to hearing it that we forget that our client may not understand what renal failure is. What they need to hear is the kidneys aren't working to clear substances from the body as well as they should be.
I had a client, I remember, was this little teeny dog who had a leg fracture. And I'm talking to this woman about the fracture on the phone, and she is coming unglued, and I can't understand why. And then the hospital manager got on and started talking about the broken leg. She says, oh, it's just broken. Going, I didn't think fracture was a big word, but you're exactly right. It's using the big doctor words and having to get down to their level. And I will always try and say the big word and then translate it in the same sentence because I don't want anyone to think I'm talking down to them, but they just may not understand that word.
Right. And I often will pause when I'm explaining things to say, does that make sense? Is that clear? Do you have any questions? To kind of open the door for them to say, well, I didn't really understand. I didn't really get that.
Dr. Nancy, we're getting close to this half-hour time, and I know I could just keep going on and on forever, but we're going to have to cut it someplace. Number one, looking at your book, how did you come up with the dog that's on the cover?
Oh, that's Sandy. You know, I was looking for a dog. I was really looking for a mutt, to be very honest with you, and I was looking for a mutt with a spot, given the title of the book is Speaking for Spot. And I was kind of looking for a dog with a kind of kooky, crazy look where you'd look at that dog and say, wow, that dog looks like she could be trouble. And I happened to find her. Her story is really interesting. She came into the Marin Humane Society. Marin County is the county just north of the Golden Gate Bridge, so just north of San Francisco. And she was one of the very first members of the Marin County Humane Society's Pen Pal program. What the Pen Pal program is they send dogs that are unruly and need better socialization, training, or dogs recovering from diseases and can't be adopted out yet. They send them to San Quentin State Penitentiary.
Wow.
And there the dogs are teamed with inmates who have been on very good behavior and deserve the opportunity to work with the dog. And they live together until the dog is more suitable for adoption. In Sandy's case, she was an unruly girl. Had no manners, and she had just been treated for heartworm disease, so she needed to be kept very quiet for a period of a month. So Ron, who was the inmate who worked with Sandy, taught her a lot of different commands. He taught her how to stay, and the actual release word from stay was the word parole. And it turns out that Sandy and Ron were paroled at the same time from San Quentin, and they lived together for about a year, until a death in the family caused Ron to have to move back east, and he couldn't take Sandy with him. And Sandy was adopted out to a family who still resides in Marin County. And she's great. I've met her. She's come to several of my book signings. She's about 10 pounds overweight, but I can't seem to convince her humans of that.
This is an awesome book. There's just so many other things that we could talk about, but tell people the name of the book again, your website, and where can they buy this book?
Sure. The book is called Speaking for Spot. The website is www.speakingforspot.com. On the website are something called advocacy aids, which are health forms that you can download for your dog free of charge. And the book is found most everywhere, certainly Amazon, Barnes & Noble, your local bookstores. I found the book in a small little bookstore in Haight-Ashbury in San Francisco recently. So you can order it online or go to your local bookstore.
Fantastic. Well, today I've had the absolute pleasure of speaking with Dr. Nancy Kay, a veterinarian in Northern California who's written an awesome book, Speaking for Spot, teaching you how to be your pet's health advocate. And soon, I have a feeling there's going to be a Speaking for Tabby book out also, how to take care of your cat. So the goal of the show has always been to entertain, educate, and to motivate you to be the best pet owner you can be. If you ever have questions about the health of your pet, the best person to ask is your primary care veterinarian. If you want a second opinion, remember, it doesn't hurt your veterinarian's feelings. You can always email me at thepetdoctor@petliferadio.com. Dr. Nancy K., thank you so much.
It's been a pleasure. Thank you.
Stay tuned, coming back next week with some new information on how you can keep your pet healthy and happy. I'm Dr. Bernadine Cruz. Take care.
Pets can be a wonderful addition to your life. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.